We're speaking today with David Gergen, senior political analyst for CNN and director of the Center for Public Leadership at Harvard Kennedy School. Mr. Gergen served in the administration of 4 presidents, Nixon, Ford, Reagan, and Clinton. He also serves on the board of several philanthropic organizations. He's got his undergraduate from Yale University and also graduated from Harvard Law School. He's the recipient of 22 honorary degrees and author of the bestseller Witness to Power. David Gergen, welcome to Conversations on Healthcare.
Thank you. I'm delighted to be here.
You know, you've been front and center in the world of politics for over 40 years, and you've watched other presidents fail at attempts to reform healthcare and provide universal access in this country. And we've just come through quite a contentious election cycle and are now equally divisive battle over the so-called fiscal cliff. But can you frame up for the public the impact that the Affordable Care Act has? Maybe give us your assessment. I think you've called it both a triumph and a tragedy. Tell us what you mean by that.
Well, in my judgment, it was a triumph and a tragedy. A triumph in this sense that 7 presidents since World War II have tried to pass legislation guaranteeing universal access to health care insurance, and all 7 failed. I worked for 2 of them, Richard Nixon way back in the 70s, who came very close to cutting the deal with Teddy Kennedy, and Kennedy said later in his life that one of his greatest regrets was not forging that bipartisan agreement way back when, but there we are. And then again, I worked for President Clinton and Mrs. Clinton as they tried to get health care through, and of course that, even with the Democratic Congress, that did not get out of committee. So, so there's been a lot of failures on this front, and Barack Obama deserves credit historically as the president who actually got it passed. And it was not easy, but he did get it passed, and we can now talk about sort of where we go from here. But I think this is going to be one of his most important legacies, and the reason that so many people around him were anxious that he be reelected was in order to protect the Affordable Health Care Act in the future, and I think that they succeeded in that. At the same time, I would say that this was a tragedy in a sense. It was a political tragedy. And I go back to the days when I joined the Clinton White House in midway the first year when they were developing their health care proposal. And at that time, Daniel Patrick Moynihan, the senator, was chairman of the Senate Finance Committee, and he has and remains for me both an iconic figure as well. He was both a friend and a mentor over the years, and I miss him today. But he pulled me aside more than once during that first Clinton year to say, David, whatever happens, we must ensure that this is a bipartisan bill, that it passed with bipartisan support. He said that if you look back over history, the great social milestones of contemporary American history have been bills that have passed with supermajorities, pointing all the way back to Social Security and coming forward to Medicare, Medicaid in 1965, to the Civil Rights I, Civil Rights II in the mid-'60s, all the way up to tax reform in 1986. And he said, the reason you want to go bipartisan, it takes the issue off the table. So in effect, it says to everybody, we've settled this issue, now let's move on to other problems. And the tragedy in the case of the Affordable Health Care Act is that in passing it, it was passed with only the votes of one party, the Democratic Party. And as a result, it has become a political football. It was obviously a central issue in this past presidential campaign, but it's going to continue to be opposed in a variety of ways, whether through lawsuits or through, how the exchanges are set up or a variety of different things we'll see, because it wasn't settled. If we had both parties agree to it, if they'd been able to work out a compromise that both parties could agree to, I think we would have been far better off.
Well, David, I don't think there's anyone who would disagree that it's a tragedy that there wasn't a bipartisan support, and yet it seemed that there was, in fact, no alternate plan that was being proposed to which people could meld into this legislation, that we were so polarized. And I wonder if it's all speculation at this point, or it's, what might have been. But were there elements that you thought were offered by the Republicans or by the conservatives that would have made this a better bill that you wish had been included in the final legislation?
I think that the reason it wasn't bipartisan was I don't think that people who negotiated it, not all of them were doing it in good faith. The president had a Democratic Congress, but he also had, he controlled the Congress, but he also had significant Republican opposition in every form. There were clearly people on the Republican side who didn't want anything like this to pass, who did not believe that this was the right way to go for the country. And part of it was that it was Obama, had his name on it. For example, the mandates. The idea of mandates started, as President Obama has said several times, found its home in the Heritage Foundation, which is a conservative organization, as you know. And yet, when Obama proposed it, it suddenly became anathema. So there are legitimate arguments on the side of the Democrats. that there were people who, on the Republican side, who just didn't want to vote for it because they had Obama's name on it. But I must tell you that I think that there were some legitimate concerns and there's some legitimate criticisms coming from the right. For example, we had the meeting at Blair House in which there were a variety of discussions. That meeting should have occurred far earlier in the process if you truly wanted to have a bipartisan conversation. And B, the Republicans did put some ideas on the table. Lamar Alexander, senator from Tennessee, put a number of ideas on the table, and I think it's fair to say that there was no heed paid to those ideas. I think the Republicans would have been more open to compromise had there been something done on malpractice. They believe that's one of the driving forces behind the cost of health care, and yet we know the Democrats are very beholden to our lawyers. That's politics. So could they have worked out a compromise? I think there's a legitimate question whether it was possible. But I also think neither side tried as hard as they might have.
Mm-hmm. David, we are moving from the frying pan of the election into the fire of debt reduction negotiations.
Sure.
And prior to the elections, I think you were critical of the Republican Party in terms of their obstructionism. Post-election, you've been focused in on the heavy-handedness of the Democrats and how they're managing this. So now we're looking at the tough reality in 2013, a new year in which there must be some meaningful compromise to address the deficit. Can you give us your wisdom on the compromise that will be both good politics and good for the country?
I do think there's a deal to be done, and I think people of goodwill could do it. I actually think if you put 10 governors in a room with some of the leading mayors in the country and put equal numbers from both sides in the room, they would come up with a deal within 24 hours. Because governors and mayors tend to be people who have to solve problems. And I've noticed that they're on education reform, for example, you find across party lines a lot more agreement than disagreement among some leading governors. Washington is a place of dysfunctionality and posturing to a remarkable degree now, and it's really hurt our politics. And now we can talk about who's being heavy-handed and who's not. But let's go to the question of, is there a deal? What would the deal look like? I don't think there's any question that the central element of a deal would be revenue increases, partly based on tax rates, that are accompanied by at least two changes, and one's going to be I think two changes in Medicare that are pretty obviously on the table, and that President Obama was willing to consider last year. One would be a change in the Medicare age of eligibility. The other would be on means testing, so that the wealthy would pay more in effect or have less benefits. I think the president also was willing to consider last year was something which is very important, and that is how you measure the inflation index for Social Security. There is some feeling that the index is overly generous in terms of it doesn't truly measure the costs of people. Now, all of these, I think, taken together, the components of a deal would primarily put the burden on the more affluent, and I think the president is right that the more affluent in this country can step up and pay a greater share. I would also wish that we would drop the rhetoric of attacking people who are successful as somehow villainous, and just say, look, we all have to do something here. We all have to sacrifice to some degree, but the more affluent are more able to do that. So I think the burden on taxes clearly is going to come from the upper income. And the burden in terms of entitlements, we ought to do it in a way that we protect people who are really needy.
David, your career really started very soon after the launch during the Great Society of Medicare and Medicaid. And it seems in previous campaigns and previous generations, we always heard a lot about Medicare, didn't hear so much about Medicaid. And yet in the more recent debates, Medicaid has moved to a much more central position. And I think one of the problems on many governors' plates to solve is the growth in their Medicaid budgets.
I'm not enough of an authority on exactly how delivery of health care services. Our daughter is a doctor, family doctor, works in the Boston Medical Center, works with the underserved population, very tough problems, and I hear a lot from her about how difficult life is for people at the lower end of things, and so many of us are pretty far removed from that. And I think we should be very generous toward those who are needy. At the same time, I think there is no question that we have, inefficiencies that are not necessary. The cost of disability is skyrocketing in this country. And, we've put more people on disability since the recession ended than we have into jobs. There is something fishy about that. There is something that raises questions about how many people are gaming the system? And we don't know the answer to that question, but I think it deserves consideration because we have limited resources, and they ought to be devoted to the people who truly need them, and we ought to find ways to cut back on benefits we've promised to those who really don't need them. And I think that's one of the reasons that it's worth talking about the tax deduction system. In order to pay for health care for the needy, do we really need to give tax deductions to people who buy super houses and get $1 million plus mortgage? And I happen to be in the more affluent group, and I don't see how to justify that. I don't think there are enough incentives in Obamacare for healthy living. The Republicans also put that idea on the table, that if you have health insurance and you live a balanced life and eat in a nutritiously good way, you exercise, and you can keep your health care costs down, you ought to get some benefit from that. I think it's crazy to think that any time we try to touch Medicare or Medicaid, that somehow that's anti-poor. You're insensitive, inhumane, and that sort of thing. I look at what the bipartisan center did with Alice Rivlin as a co-chair of the committee with Pete Domenici. Alice Rivlin is a strong Democrat who comes in and says, we can make changes in these Medicare and Medicaid programs that will actually save money that are not necessary to protect the needy.
I want to get back to one of the comments you made a little earlier about the ability to get governors and mayors in a room and that they have the capacity to get things done, which had me sort of thinking about the core skill sets that you need to govern in this country. And, there's a whole sea change happening, not only in healthcare, but in technology, sort of transforming the way that people do business. And you're the head at the Center for Public Leadership at the Kennedy School of Government at Harvard. So what are you trying to impart in these new leaders about the core skill sets that they need to lead our country through all of the disruptive changes and forces that are going on at this time?
That's a good question, and we wrestle with that regularly, and it's not always clear what skill sets you need. Clearly, though, I think it's very true that to be in the future, one is going to have a wide bandwidth, that you need to be well-educated, well-schooled, well-trained in a particular area so you've got depth. Increasingly, leaders are called upon to make decisions across a wide spectrum of issues and complexities. You have to learn how to live, to work in partnership with other leaders. In days gone past, you could be the leader of your own organization. Today, in order to get synergy or leverage, you really have to work with the leaders of other, if you're in the nonprofit sector, for example. I've just come back from New Orleans where we had a conference with the leading education reformers in the K-12 area, as well as leading philanthropists like Eli Broad and Wendy Kopp of Teach for America. I'm on the board for Teach for America. And she called this gathering, and it was very clear that among the education reformers, many of whom are in the nonprofit sector, that they get a lot more bang if they work together, not only within the organization but across organizations, and if they reinforce each other, if you in effect create an ecosystem. So that Teach for America may provide teachers, but there's new leaders for new schools will help provide principals. You've got groups like City Year that try to work on this dropout rate. There are an array of things that have to be done, and good leaders have to work on across systems, and they have to work, frankly, a growing number of people that coming out of these good schools are going to have to learn how to work across sectors. They're going to spend part of their lives in the private sector, but they're very likely to spend a chunk of their lives in the nonprofit and in the governmental sector. And it's important to understand that. We've got to internationalize them. They've got to understand how to deal with the new internet world. But most of all, very importantly, it's a question of creating a culture in which we see we're all in this together, and that it's one for all and all for one. We had a visitor here on our campus last night with a group of our students who was a man of 41 years old, and he has just come back. He graduated from Holy Cross in mathematics. His name is Mike Hayes, and he went on to go in to join the Navy SEALs some 19 years ago. And he became a White House fellow. He's worked in the White House in the national security area in high-level positions for both Republicans and Democrats. And then he went back into the Navy SEALs, and he just came back from Afghanistan, where he was in charge of 2,000 people. Now, he brought his men back alive. And the way they brought their men back alive, and they had no civilian casualties, on the Afghan side. They had a huge amount of discipline. They had enormous amount of dedication to each other and to the common cause. And you can't lead by regulation and rules. You have to persuade. You have to mobilize people through a belief in a common effort. And I think we can do that in the healthcare field. One of the things I'm encouraged about in the healthcare field enormously about where we go from here is that the younger generation of doctors, and I say this partly because of my daughter, is the new generation of doctors coming up. They're not in it for the money. They're not in it fee for service. They're happy to take They're happy to take a salary, and they're happy to work collaboratively. That kind of change in medicine, working toward accountable care organizations, can bring a lot of reductions in costs as well as an increase in wellness. Catherine, our daughter, finds that in working with poor families, she's achieving a lot by working with groups so that you've got young expectant mothers who don't come in one by one. They'd have one-by-one attention if they need it, but they come in and have a support group of 12 or 15. They meet once a week. They spend a lot of time bonding and trying to help understand each other's problems and supporting each other, and it's a much more satisfying way to practice medicine. By the way, it gets good results. So I think the younger generation is much more innovative than those of us who are older, and we'll find solutions to this. But we have to build a culture in which people like doctors are set up. It's like, wow, that's a wonderful thing to be doing. But also the pharmaceutical companies, they can do some good things here. They're very innovative. We don't need to just see them as greedy villains in all of this piece. I was just with the health insurance community. There are a lot of people that are trying hard to get this system to work. And I think it's best done by yelling and screaming at each other, by encouraging the best in each other.